Hello and welcome to Falcon Reviews for USMLE Step 1. My name is Ajman Mufti. I'm a GI Fellow at the University of Chicago Medical Center, and I'll be going through the GI Physiology module with you. For the purposes of this review, we have broken up this module into a number of different sections. The first section will serve as an introduction to gastrointestinal physiology and a primer for what's to come. Hello and welcome to the online course for Falcon Physician Reviews. My name is Ajman Mufti. I'm a GI Fellow at the University of Chicago Medical Center, and today we're going to be reviewing gastrointestinal physiology. We've broken this lecture up into different modules, and the first section will be a brief introduction to the GI tract and its physiology. Gastrointestinal physiology involves multiple phases as food travels through the body. This starts off with the cephalic phase, followed by the oral phase, going on to the pharyngeal phase as food is swallowed, through the esophageal phase into the stomach, and then the duodenum, small intestine, and finally the large intestine prior to the expulsion of waste products. The cephalic phase is one of the first phase and is often overlooked as part of GI physiology. The hypothalamus plays a pivotal role in this and contains the lateral nucleus or the hunger center and the ventromedial nucleus or the satiety center. What's important to remember is that there are multiple stimuli which are responsible for activation of either of these centers. So with glucose, hypoglycemia increases stimulation of the lateral nucleus, resulting in increased hunger. The lateral nucleus can also be stimulated by sight or smell of food. This becomes important especially when patients lose the sense of smell and therefore have decreased hunger because they don't have stimulation of the lateral nucleus occurring. Central nervous system lesions affecting the lateral nucleus result in no hunger, and lesions that affect the medial nucleus result in constant hunger. Clinically, these are manifest by two different syndromes. The first one is Prader-Willi syndrome, which is encoded on chromosome 15 and is a great example of genomic imprinting. This is encoded by paternal genes where there's an inherited deletion or unipolar disomy. Patients with Prader-Willi syndrome have a huge appetite and are often significantly overweight later on in life. Angelman syndrome is again on chromosome 15, but as another example of genomic imprinting, is encoded by maternal genes. Angelman syndrome clinically presents itself with patients who have lesions in the satiety center and therefore are not hungry. Patients often have inappropriate laughter as well as cognitive impairment. The main neurotransmitters present in the hypothalamus are norepinephrine and serotonin. Amphetamines cause an increase in the release of preformed catecholamines, so norepinephrine and serotonin levels go up. These subsequently hit the satiety center, resulting in a lack of hunger. SSRIs, TCAs, and MAOIs take away appetite or make you hungry depending on the degree of release of norepinephrine and serotonin induced by them. Amphetamines that cause the release of catecholamines include dexatrim, methylphenidate or Ritalin, Pemaline, Adderall, PCP, and ecstasy. When the body first experiences stress, the response is parasympathetic, followed by a sympathetic response. This occurs because neurotransmission through the parasympathetic system is quicker than through the sympathetic system. Therefore, parasympathetic responses result in an increase in GI motility. Literally, this is manifest by patients saying that when they're scared, they had the poop scared out of them, or an increase in the amount of GI acid output. Hence, patients, or in real life, people complain about heartburn when they're very stressed. Sympathetic responses result in increased vasoconstriction in the GI tract as well as the skin. So, for example, with stress ulcers occur when the GI tract doesn't have enough blood supply to protect itself. There are two different types of stress ulcers, namely Curling's ulcers and Cushing ulcers, and we will discuss these later on. This is not to be confused with Cushing's triad, where In the presence of a raised intracranial pressure, we have the classic triad of hypertension, a widening pulse pressure, and bradycardia. That served as a brief introduction to GI physiology, looking at the neurotransmitters that are present and discussing the different phases involved in the digestive process. In the next section, we will be looking at the oral phase of digestion and the importance of swallowing and mastication in this process.